Good afternoon and a very warm welcome or a welcome back to ISNTD Climate and Health, our one-day conference here at the International Society for Neglected Tropical Diseases. It tries to shine the spotlight on the linkages between climate and health and looking at that through the lens of diseases and particularly neglected tropical diseases, as well as health systems around the world, and particularly health systems that serve some of the more vulnerable communities around the world. We've had a really packed and rich half a day already. This morning, we heard a lot about the imperative to tackle climate change, given its huge and disproportionate impact on health worldwide. And we've also heard about the many initiatives, partnerships, research, modeling, from data all the way to policy that's really building the evidence base for those linkages between climate and diseases. And as the day unfolds and as we now turn towards the second half of this event, we felt it would be really interesting to hear a little bit more for this network that's very much focused on healthcare systems, whether at a primary level or at a more at a broader advocacy and policy level, to really focus on what is the impact of the healthcare system on climate, but also what are many of the opportunities for all sorts of healthcare stakeholders to affect change and improve, mitigate, get in and build resilience at a global health level and really tackle these climate impacts on health. So against all that background and with this context, it's my huge pleasure to welcome today's panel. I'm sure many of you will not need me to introduce the colleagues that we have on screen, but I will do so anyway. And it's an absolute pleasure to welcome our speakers today, our 5 speakers who will be talking to us a lot more about the role of the healthcare sector in climate mitigation. And going around my screen, I've got, at least on my right, on the top, Dr. Robin Stott. Hello, Robin.
Hi, nice to meet you all.
Thanks for joining us today. You have worked as a physician and also as the medical director of a very big hospital here in London, the Lewisham Hospital. You're also founding member and ambassador of the UK Health Alliance on climate change. Thank you for being here. I'm also very pleased to welcome Dr. Elena Villalobos Prats. Hello, Elena. Thanks for joining us today. You're technical officer in the Climate Change and Health Department at the World Health Organization. It's very nice to meet you.
Hi, happy to be here.
Thank you. Joining us from Sanofi, as well as the Foundation S, the Sanofi Collective, it's my pleasure to welcome Priscille de la Tour. Hi, Priscille.
Hello.
And Douda Diouf. Hi, Douda.
Hello.
You are respectively Global Head of Planet and Health in the CSR department at Sanofi, and Douda, you are Head of Climate Action and Health Resilience at the Foundation. It's lovely to have you here. And I'm also really pleased and very delighted to welcome Diana Picon Manyari. Hi, Diana.
Hello.
Hi. Diana, you're International Climate Director at Healthcare Without Harm. So a wonderful panel. I'm sure our live audience is joining me in welcoming you very warmly. And so without any further delay, it's my pleasure to hand the floor over to our first speaker, Dr. Elena Villalobos Prats. And Elena, you'll be talking to us about a recent report launched at WHO on the role of the healthcare sector in climate change.
Thank you very much, and thanks for inviting WHO to be part of this important panel. I'm really happy to see friends and people with whom we've been working for a while, that we admire even. So it's very nice to be here. Basically, as you rightly mentioned, I will base my presentation on basically the work that WHO is promoting to build climate resilient and low carbon health systems. I think I will start basically by just presenting a little bit on what the causal pathways and how from the specific climate change hazards we come to different health outcomes. And I think that this is important because basically it is clear that there are a wide range of impacts on population health. And these are so wide that they include direct effects such as those caused by extreme weather events, heat stress, but also those that are mediated through changes in, for example, water availability, water quality, food availability, food safety, nutritional status of and conditions of the food we eat, but also changes in ecology, in mosquitoes. Something that is probably even better understood for countries is all the impacts that are felt in health systems, including in healthcare facilities. Because, for example, when a flood occurs or when a cyclone hits an island, there are very direct impacts like disruption of supply chain, disruption of roads, and even the inability of a healthcare facility to provide the care that they should. Something that also is important to highlight is that the capacity of the health system itself and the ability to respond to a specific outbreak or a specific extreme weather events will determine the final impacts on health. So the side of the impacts on the health of the population and health systems and facilities overall is clear. Something that is also very important for us to highlight, and others have been working on this for a long time, is also to highlight and build the awareness of the opportunity the health system has to decrease its own greenhouse gas emissions and overall environmental impact, for example, related to land use, water use. So recent estimates determine that the health sector is responsible for overall between 4.4 and 5.2% of global emissions. So you consider that this could equal over 500 coal gas fired thermal power plants. And most of it is related globally to the supply chain. What you see in this right diagram is basically coming from the NHS England, the distribution on where these emissions are coming from. So you see delivery of care, personal travel, and then supply chain is the biggest one, related to pharmaceutical, to medical equipment, to business services, and so forth. So WHO developed a first operational framework for building climate resilient health systems back in 2015. And this was widely adopted and used by countries, development partners, and technical experts. But then we recently updated that so as to include also the part related to low carbon sustainability. What you are seeing on the screen is basically the overall approach to building climate resilience in health systems. So what we have is a certain capacity of health systems, which can be low, below average, acceptable, normal, or above average. And then we have specific shocks, could be heat wave or stresses, could be sea level rise, could be drought, increase in temperatures over a certain period of time. And then basically based on different vulnerability, the hazard and the exposure of this health system, you can have different outcomes related to resilience. So in many cases, unfortunately, the health system will collapse and will be unable to respond to a specific outbreak or crisis, could be able to recover but worse than before, recover to the prevent state and better than before or transform. Something that is very important when building climate resilience is basically considering the need to strengthen the capacities related to health systems and also reducing overall vulnerability and risk. So those related to exposure also. When it goes to applying a low carbon approach to health systems, and I'm sure Diana will go into much more detail during her presentation, basically something that we are promoting from WHO is a mixed approach that combines top-down, so basically a national health systems with bottom-up approaches that are mostly focused in healthcare facilities or sub-regional level. And what you can see there is the different scopes related to the emissions, direct, scope 1, scope 2, and then scope 3 that is more related to supply chain. And again, there are different interventions that I will cover in more detail in the next slides. Something that we've done with this updated operational framework for building climate resilient and low carbon health systems is basically to compare health system performance of countries and then their emissions with also a measure that we have to assess the capacity related to climate change and health. And basically what you can see, putting together, you can see that there are many health systems that are emitting very low and that at different levels of performance, very low, medium, and high. And then there are other health systems where you can see that they are emitting much more. What you can see on the right is basically the different pathways that we think countries should follow so as to be able to commit to net zero emissions in health systems by no later than 2050. So basically what we build on their baselines for performance and their emissions to suggest specific pathways that they should follow. I will not go into detail, but basically for those countries that have very low emissions and very low performance health systems, probably they will need to basically just focus on climate resilience, ensure basic access to services like those related to energy, water, hygiene, waste management, which in some cases will even mean that they will need to increase their emissions, but at the same time, they should be adopting technologies that will allow them to overall reduce the emissions for this specific topic, like could be waste management, could be energy sources that are greener. And so depending on these different baselines, you can see the different pathways there. So basically, this is the summary of the operational framework, the visual representation of it. We follow the same structure that we have for the first one, looking only at resilience. And basically what we did is to look at the building blocks of health systems: leadership and governance, health workforce, information systems, essential medical products and technologies, service delivery, and financing. And around those, we develop specific functions, a total of 10, that if implemented will allow health systems to both build resilience and decrease their overall greenhouse gas emissions and environmental impact. Of course, all of these are very important. Maybe I will just mention the ones related to health information systems, because those are quite fundamental to understand baselines, but also to develop informed and evidence-based interventions. So what you can see there is assessments of climate and health risk and greenhouse gas emissions. So for that, there are different tools, like, for example, there is a specific tool to assess countries to conduct climate change and health vulnerability and adaptation assessments, basically developing the evidence on the interlinkages between climate change and specific health outcomes, priorities in each of the countries. There are also tools that will allow countries to assess the vulnerability of specific healthcare facilities to the different climate change hazards. There are also tools developed by others to support health care facilities to understand where those emissions are coming from. And Diana and Healthcare Without Harm are already promoting one of these tools. Another very important one is promoted by Aga Khan Development Network. Another very important function there is the one related to integrated risk monitoring, early warning, and greenhouse gas emission tracking. So basically, with all the information that we are able to gather, current information systems for specific climate-sensitive diseases like cholera, malaria, dengue, should be able to get and integrate climate and weather information so as to better understand how specific health outcomes are going to be sensitive to climate change. And in the simplest ways, they could at least develop risk maps that will allow them to understand seasonality or changes in these seasons, and then tackle and address specific hotspots for these specific climate-sensitive diseases. And the same with integration of other environmental considerations like water quality, water availability, air pollution, energy sources, and also basically understanding when those emissions are coming from. All this will inform how the delivery of those specific programs is changed. This is just one example of the operational framework that related to component 1 on climate transformative leadership and governance. For each of these 10 functions or components, we have 3 specific objectives. So in this specific case, it's related to governance, basically having a specific responsibility and accountability mechanisms on climate change and health, established within the ministry. Policy development, making sure that both climate resilience and low carbon sustainability are integrated into relevant health policies and programs. And then cross-sectoral collaboration that will allow that decisions taken in other sectors are also contributing to the protection and promotion of the health of the population. As example of proposed interventions and measurable outputs, basically under the objective related to governance is establishing and having a focal point for climate change and health within the Ministry of Health or specific units, and also having the health sector, the Ministry of Health, committing to building climate resilient and low carbon sustainable health systems. Under policy development, for example, having strategies or the health component of a national adaptation plan, and under cross-sectoral collaboration, basically having, for example, MOUs signed between different ministries. So this is just summarizing the approach that we have for looking in more detail at healthcare facility level. So basically under the overall framework that is looking at national health systems, and without forgetting, for example, the importance of surveillance or of having specific policies, regulations at national level, then we promote 4 specific components at healthcare facility level. And those are mainly related to health workforce, energy, infrastructure, technologies and products, and then water, sanitation, hygiene, and healthcare waste. This is just to summarize the different tools that we have developed to support in more detail the specific functions and components, summarizing this operational framework that countries can basically refer to for more details and specific methods for some of the proposed interventions. And with this is all from my side.
Thank you so much, Elena. That was an amazing introduction for, I suppose, many in our network who are in the health field but don't necessarily think in terms of healthcare systems and climate. So that was a really great overview of the impact of the healthcare sector on climate, but also the many opportunities and those all very useful frameworks in which this sector can effect change at every level. So thank you so much for that. You mentioned in your presentation that Healthcare Without Harm, Diana, was supporting and focusing on one of those frameworks and interventions. And so that provides a perfect introduction and opportunity to hand over to our next speaker. Diana, over to you to tell us a bit more about how Healthcare Without Harm supports healthcare institutions towards their climate mitigation goals.
Thank you, and thank you for the invitation to speak to you today. Excellent, and thank you again, and thank you to the audience for this opportunity to speak about our work, the work that we've been doing with others as well, like WHO and other institutions around the world. This is an incredible opportunity to talk about also how the audience, you in the neglected tropical disease space, can also be part of this movement. We call it a movement because it is. It's a part of a group of people who have been working very closely on climate change and health for many years now, and where we see the fruits of this work now producing not only technical documents, but really actions and policies that we believe will help us in fighting and winning this fight against climate change. Next slide, please. Thank you. So for us, this, as Healthcare Without Harm, we've worked for over 25 years with the healthcare sector. And we started working really around toxics and mercury at that stage. And in the years past that work, we've been starting to really focus on climate change. And a few years ago, we published a couple of papers, of reports, along with the consulting group Arab, around the healthcare climate footprint, which was one of the first efforts in measuring the healthcare sector's contribution to our global climate crisis and how to confront it. And then a couple of years later after that, we also published the Global Roadmap for Healthcare Decarbonization, which is in line with Paris Agreement goals and tries to identify where the key areas of the health sector can contribute to reduce emissions the most and how to tackle these in a more practical way globally, but also with some profiles for different countries as far as we could get information and data for them. The first report, the Healthcare Climate Footprint, Elena talked a little bit about this already, but the idea here was that we found that about 4.4% of worldwide emissions were coming from the healthcare sector. Since that time that we made this calculation, the Lancet Countdown has actually been taken over and actually producing reports yearly that tell us more about the climate footprint. And we've heard, I think the last report says 4.6%. That was for this year. And it's kind of, as Elena said, somewhere between 4 and 5%. It is equivalent, of course, we know the global climate footprint is equivalent to annual greenhouse gas emissions from 514 coal power plants, as Elena also mentioned. And the main thing that we do say about this is that if the health sector were a country, it would be the 5th largest emitter worldwide, and that's not that's not a low bar to cover. It's when we explain this and they say, oh, it's only about 5%. No, that's not that much. It actually is. It is a big deal. And the fact that it's coming from a sector that is supposed to heal, that is supposed to promote health, it's important that we take into consideration that. The next report that we worked on was around the global roadmap for healthcare decarbonization, and it really talked about how if we did business as usual, the health sector emissions would triple by 2050. Of course, this is unacceptable for the healthcare sector. Meeting Paris Agreement commitments could reduce healthcare emissions growth by 70%, which was also a huge finding. We also found that healthcare, it had responsibilities and respective capabilities in different countries, with rapid decarbonization of healthcare in developed countries needed in order for us to really reach the goals of decarbonization, and combined with low carbon health sector development in LMICs or low and middle income countries. This is key. In Healthcare Without Harm, what we do, we have a couple of really powerful tools that could help us bring about this change. The first one is that we host this network. We call it the Global Green and Healthy Hospitals Network. It's a bit of a mouthful, the GGHH network for short. And it has been going around for the past decade and has grown tremendously. We have over 1,800 members in 84 countries that represent over 71,000 hospitals and health centers worldwide in different regions. And as you can see from the colors, we have quite a bit of a presence in this network in Southeast Asia, Asia really, Latin America, Europe, US, with a growing network in Africa, and also a very powerful one in Australia and New Zealand. One of the initiatives that we launched with the network is the Race to Zero. We are the official UN framework for climate change health sector lead, which was born just a couple of years ago in 2021. And members of the GGHH network can join this campaign. It's the largest coalition of non-state actors and subnational governments that take rigorous and immediate action to halve global emissions by 2030, and for our sector to reach net zero by 2050. We have now, of the GGHH network members, 78 healthcare institutions representing the interests of 14,000 hospitals and health centers in 28 countries that have joined the Race to Zero through this network. Now, that has a commitment behind it, and I want to talk about that a little bit. The Race to Zero campaign has 5 very important criteria, and we call those the 5 Ps. The first one is to pledge, because we need to make sure that that commitment is made publicly, that health systems, hospitals and health centers set those targets and that are very public about it. It's a part of an accountability mechanism, if you will. The second P is about planning, and it's about publicly disclosing a plan that outlines how the Race to Zero criteria will be met, including what actions will be taken, the timeline, any institutional arrangements. And it needs to be done within the first 12 months of joining the campaign. Proceed is the third P, and that's about taking immediate action. Maybe perhaps you don't even have to do a baseline measurement of the emissions at a hospital or a health institution, but you implement interventions as soon as possible, even before having that plan and those targets. Publish is the fourth P, and that's about reporting publicly both the progress against the interim and long-term targets, as well as the actions that are being taken. And we, as the campaign states, should expect that report to be done annually. And the final P, and that's usually for those that are most mature in the campaign, is persuade. And that's about engaging with the broader community to promote climate action, including local community, but also the supply chain actors in that health system, policymakers, and gather or garner support from the public as well. And these are the 5 Ps that really comprise what we expect Race to Zero members to accomplish. With these health institutions, we have done quite a bit of learning in the past, particularly in the past 12 months, because remember, it's a pretty young campaign. But we have been gathering quite a few case studies from around the world. Now we've gathered almost 40 case studies of health systems working both on resilience and mitigation, from what approach they've taken to measuring their footprint, to perhaps already actions around how they've reached out to the community to make it more resilient, or to also how they may have improved their waste management techniques, or how they may have improved their sanitation or their energy consumption, or even how they may have changed their energy source from the regular grid to a solar powered or renewable grid. So these are very important actions that we're trying to collect, so that it inspires others to do the same. We've also come up with an action plan template. One of the things that the members had been asking for many months was, well, okay, we need to do an action plan. What does that need to have? And working with them, we've developed an action plan format that has kind of the minimum requirements for them to have those first steps at putting one together. And finally, we're just really building a community of practice for the Race to Zero members. And we've been trying to gather both virtually, but also in person in different types of events, and also engaging them in different ways through surveys and understanding what might be their needs in terms both of technical resources, or also what capacity building needs they might need. I actually thought Elena was going to be talking about this, but I think that she had such a great presentation. It was so rich about the new framework that I will share this with everybody, Elena. But something that the WHO is leading that is really, really important is the Alliance for Transformative Action on Climate and Health, ATTACH by its acronym. So ATTACH kind of was born out of the COP26 health program, which was an initiative that was led by WHO, the UNFCCC, the COP26 presidency in the UK, and Healthcare Without Harm working together to basically ask countries to commit to two very important actions. One was resilient health systems, and that might be by setting up a health national adaptation plan and doing vulnerability and adaptation assessments. And then there's another track that's around mitigation, and that will be around low carbon health systems. And that may mean setting baselines and targets and putting together either an action plan or a roadmap for each country in the coming years. And some of them, actually, some countries have gone even farther than that to commit to net zero health systems. We have 76 low, middle, and high income governments that have joined the ATTACH initiative, but 28 of those have actually pledged to net zero healthcare, and 75% of those 28 are actually low and middle income countries, which is really amazing. It consists of 4 working groups on resilience, decarbonization, supply chain, and finance. And it really is a global platform and mechanism for bringing together the ministries of health, but also those of us, civil society, research institutions, technical partners, and other stakeholders who are working in the same space, who have something to also contribute technically to advance these commitments. And so it's a really great initiative, and it continues to grow. It was actually 52 countries at the beginning of the COP26 health program, and it has grown up to 76 in a couple of years. Next slide, please. And I also kind of wanted to talk about a bit of the work that we've been doing supporting health systems, not from the bottom up only, as Elena talked about, right, but also from the top down. And some examples that we have are coming out of from Europe. They're designing a net zero roadmap for healthcare. This is a report that we came up with, our Europe office came up with. It's a methodology and guidance for countries who are taking that top-down approach. We piloted a couple of years ago this project called Operation Zero, and we piloted it with 3 governments in Europe. that would require us to finalize the mitigation plans for the health sector, one of which was in Portugal, and you can see the plan there. And another one is in Latin America, where we've been working with the Ministry of Colombia through a bottom-up approach to work with a representative sample of facilities to measure its footprint. But they are also looking at how this will look at a plan for the sector in the coming months. We have a couple of other countries in Europe that are starting to work with us on the top-down approach, and a couple of Southeast Asia countries that are interested in also this top-down, bottom-up approach that we may be helping them with next year. Part of this work, and next slide, please, is really a bit on the technical side, and it kind of goes around exactly as Elena said. I was going to explain a little bit about scopes 1, 2, 3, and the supply chain. As you notice in one of my other slides, supply chains make up the most emissions worldwide of the healthcare sector, and they are kind of the mystery box for us. It's where we have the least amount of data. We tend to do it through costing analysis rather than through other means. So it becomes quite a bit difficult to estimate them. But through Attach and through other means, we are trying to not just the measurement side, but actually do have actions that will apply to the supply chain. Part of this work then means that we need to help countries and help institutions do this measurement of their carbon footprint, both for the COP26 program commitments and as a baseline measure to see how the sector is actually being held accountable and how we're moving forward in our goals. So the Climate Impact Checkup the Climate Impact Checkup tool is the tool that we came up with at Healthcare Without Harm, that we developed a couple of years. Well, actually, it's been at work for several years, but developed worldwide in the last couple of years to help health institutions actually do that. And I just wanted to share with you that yesterday we launched an online course of the Climate Impact Checkup tool, which allows anyone access to the Excel version of this tool. So if you have a healthcare institution and you're wanting to kind of understand more, please check it out. You have the QR code there and the links. The course will take you through not just the course, the tool itself, but also a bit of the background on scopes 1, 2, and 3, so that you have a bit of more general knowledge. It's meant for health professionals, policymakers, and anyone in between really who is interested in calculating baseline emissions for healthcare sector and continuing to do so year to year. And I just finally wanted to leave you with some thoughts about what can leadership in health institutions do. So the first and foremost, as we said, the Paris Agreement targets are very important. You've probably heard it from different speakers earlier today about the effects of not reaching the goals of the Paris Agreement targets and how it is a matter of life and death today, and how it's important to commit to reduce our greenhouse gas emissions. We also would extend the invitation for you to connect with and coordinate with efforts that are happening in your country or in your locality with other health sector stakeholders and other sectors that are already engaged. This is really important. Learn. We're still learning. We are learning. We are experts in certain things, and we're still learning about what does it mean to decarbonize. Learning from those case studies from healthcare institutions, measuring, planning, all of these are very important things, as it is setting standards and require them of suppliers, of your suppliers, to meet those. One thing that I think the NTD community is very aware of is how important the social determinants of health are, and advancing in upstream interventions that address poor health due to environmental issues, including climate change, are key here. I always say the best health intervention in terms of GHG is the one that doesn't have to happen, right? So if you have clean water, if you have a clean environment, if you're living a healthy environment, the least likely you are to need the health interventions that you're needing today. divesting from fossil fuels. We know that the climate crisis is here, and one of the major contributors is the fossil fuel industry. So understanding where those investments go and making sure that they are not going into fossil fuels, that's really important. And finally, and I hope that Robin will also talk more about this, is leveraging the voice for policies that connect climate and health. The health sector should and is and will continue to be a leader in this space. We have not only the power of science, but the power of the communities we serve, and the power of our economic power to really lead change in this area. I thank you very much again, and I hope that this was useful, and I hope to hear from you soon. Thank you.
Thank you so much, Diana. That was not just useful; it was just amazing. A real rallying point for anyone who would like to explore what their healthcare institution, organizational system can do with some very, very practical tools there. So thank you. That was really wonderful. And it was so interesting how you mentioned right at the start of your presentation, this is a movement, and one really gets that sense that those involved in building these indicators and frameworks and solutions have known each other a long time. But what that means is that there's a very strong, very active community of practice. And so I'm sure that many who are listening in today will feel very welcome to join in. So thank you so much for that. And so it's a fitting moment to hand over now the floor to stakeholders in the healthcare system. I would like to mention that in the final session of the day, we will be hearing from a colleague, Dr. Churchill Taboe, who's been very much involved in field on a primary healthcare level as NTD program manager in the Bayelsa state of Nigeria that experienced tremendous devastation through flooding and what this has meant for the healthcare sector. So for timing reasons, he's in the final session of today. So one perspective from the primary healthcare level, and another perspective, and I'll hand over the floor now to Priscilla and Dauda from a big pharma perspective. What can the CSR do in terms of being a healthcare stakeholder? What can a foundation at that level do to help mitigate the impact of climate? So it's a great pleasure to hand over to both of you for the next presentation. And thank you very much for being with us.
So jumping in, so I'm going to try and not repeat what has already been said by Diana and Dr. Elena. So basically, this is a figure you've seen before that was presented by the WHO. But what we wanted to remind here is as well, like how there's a bilateral relationship between environmental change and health, and also by the fact that climate change is bringing a lot of vulnerability within exposure pathways by increasing diseases and creating a lot of risk on certain diseases. But as these risks and these diseases increase, it is also creating a lot of stress and additional emissions from health systems in of themselves, which means that because more resources are needed, then it is increasing the emissions, and the emissions who are actually exacerbating by on the second time the diseases and people's health. So we're really looking at this bilateral relationship at Sanofi, and what we try to do is really try and bring a diverse and holistic approach. So there's 4 pillars to what we try and do. The first one is obviously to try and reduce the impact of our activities in our products and the environment. As you've seen before, about 50% of the emissions from the healthcare sector also come from pharmaceutical companies. And so our responsibility is first and foremost to try and reduce these emissions. And this is what we're trying. So this is the first thing that we're trying to do. Secondly, we also think that we have a responsibility in terms of bringing innovative medicines and vaccines to protect the patients that are actually being impacted by the exacerbation of certain diseases and by climate change. And this is a key place where by investing in research and development, by bringing innovation to the market, we can actually actively protect additional patients. Another part that we're looking at, and this had been mentioned before, is around driving coordinated action and really insisting on this coordinated action to reduce the health system carbon footprint. Because the emissions in the health system are quite fragmented, they come from a lot of different places. It's only by having this collective work that we'll actually be able to sustainably reduce the emissions. And finally, and Dauda will tell you more about this, is that we work at supporting the most vulnerable population on the adaptation process and really building the resilience of these populations to environmental change. And this is all the work that's being done by the foundation that we have and that we'll talk a bit more about later. So jumping into the first part, I wanted to just say is that the main aim is first of all, for pharmaceutical companies to reduce their own emissions. And this is where we're on a journey. So again, repeating a few of the key messages, but it's really important to say so, is that like we're working towards carbon neutrality by 2030 and as well net zero by 2045. And to do so, there's a lot of key actions that can be taken in terms of so building this carbon neutrality, but also limiting the environmental footprints and building circular solutions for our plants, but also for our products, and really trying to improve the environmental profile of products that we have. There's also a lot of work around mobilizing our people and our networks and engaging with our supply chain. A lot of the emissions, as presented before as well, come from the scope 3, so from all the supply chain and the indirect emissions. And this is a key part in trying to coordinate and engage with our partners to make sure that we're able to actually reach these targets. Jumping to maybe the other pillar, which is around decarbonizing health system. This has been showed before, but really going into a bit more detail. So as a pharmaceutical companies, because we have the responsibility of reducing our emissions and the supply chain part, which is about 50% of the emissions, but there's still about 40 to 45% of the emissions that come from the patient care setting. And there's increasing need and recognition. There's a need as well to act on this patient care setting and how we can actually participate in decarbonizing the patient care pathway all along the journey, particularly for chronic diseases or non-communicable diseases. We also have this need to make sure that as the patient evolves and as the disease evolves as well with the patient, how all along the patient care setting, we can make sure that we're reducing the emissions. And this is a mission that Sanofi is leading as well with a consortium called the SMI, the Sustainable Market Initiatives, which has been created during COP26 that happened in Glasgow, and really trying to work across industry, but public and private sector, to try and make sure that we can reduce these emissions. And as we can't do it alone, we are really looking at 3 different things. So we're trying to build harmonized measurement frameworks, which means that making sure that if there's these measurement frameworks are adopted, if people are making measurements to try and quantify how we can reduce the emissions in the care pathways, that we're doing it in the same way, that we're using the same way of doing it, because then in that way we can all make sure that we're acting and impacting the hotspots, and that we've identified how we can do so. And once we've actually harmonized the frameworks, that we make sure that countries are adopting these frameworks and working in the same way, we can make sure that then we can adapt and that these care settings can adapt. And to do so, we've identified within the SMI 7 dimensions that are considered as key levers to try and reduce emissions along the care pathway. And prevention is one of the key measures, because obviously, as we arrive earlier on, as we're able to avoid the onset of the diseases, then we can also make sure that it doesn't impact the health system later on. So within these 7 levers, so prevention and disease onset is very key. Early diagnosis, making sure that we arrive very early in the care management, that we improve the efficiency of the intervention, the disease management, and as well, there's 2 key levers that we're exploring is around the proximity and digital care. How can we really bring care as close to possible to the patient? And can we use digital care to improve the health outcomes of the patients. And these are all types of measures that we've seen to have significant impact on reducing the emissions. And to move on, then I'm actually going to jump to let Dauda tell you more about what they're doing in terms of for the most vulnerable populations. And thank you very much, Dauda, for taking this. I can pass the slides if you want to.
Yeah, thank you very much, Priscilla. As you said, at Foundation S, we are focusing more on climate adaptation and health resilience, really looking at how we can increase the health resilience of the most vulnerable communities in low and middle income countries. Basically, we are focusing our work in sub-Saharan Africa and in 4 countries in Southeast Asia, which is Pakistan. As you all know, that Pakistan is a highly impacted country, Bangladesh, Nepal, and Cambodia. So when we just at the inception of the foundation, when we just decided to focus our work on climate adaptation, what we did is that we hold a series of consultation, and co-creation with people and organizations that are from communities and countries that are highly impacted by climate and health, to better understand what the needs are, but what the local solutions are, and how what potential we could see in terms of scaling up and also replication in a way that will bring more impact at community level. So we end up focusing our intervention at Foundation S in around 3 pillars. One is how do we sustain, how do we strengthen local and community and locally led adaptation initiative and program, and how do we also contribute to build their health resilience as they are confronted to the impact of climate change. The second, and I will come back on it, is how do we contribute, because I think one of the colleagues said it, and it's so true. Climate information and information related to the response and the consequences and the best practice when responding to climate challenges at community level is also extremely important. It's important to have hardcore data, and we are privileged to have the Lancet countdown report. We also have other data from different academic institutions. But what we are lacking is real-time data and data from the real world, and how people themselves are being confronted, and what are the solutions they're developing that can also help for the global response to climate. And finally, we focus our effort on rallying and building a collective movement, to put health at the center of the climate agenda, which is now beginning to be a reality, and we are privileged to have a health day during the upcoming COPs. But more importantly and more in detail, how do we mobilize all our effort for financing climate adaptation? I think we are not there yet, but this is also one of the key aspect of our work. So I want to focus on the first pillar, which is really how do we build resilience at community level, and how do we support all of the effort that communities are also deploying to adapt, to prevent, and to protect their belongings and their life in the face of climate crisis. This is done through different channels of support and funding. We are funding direct local intervention and locally led adaptation through direct granting. This is done through a call for proposal. Last year we have our first for proposal, and we received proposal from 30 countries out of the 31 countries that are the most vulnerable to climate change in the world, and we end up through a very rigorous process of selection. We have selected different projects from 17 countries around the world, amongst the most vulnerable countries. We're also looking at local solution, local innovation that are very local, but has a potential to be very impactful and to be duplicated or scale up at another scale. This is what we call innovation and local solution funding. But we all know, we realize, and we're conscious that we are based in Paris. We are Paris-based foundations. We are not present in the field, and we also know that supporting local response and locally led adaptation will require very close oversight, will require capacity building, will require responding very quickly to the needs of communities as they are confronted to climate and health challenges. So that's why we in each of the region we are working with what we call regional climate action regional accelerator. It's a organization that has a presence in the region or in a country that have proven experience to support local response to health, to support also the primary healthcare system as well as the community system in health, and who also have shown their experience in building the capacity to take to scale the most promising responses. And finally, we are also working with to develop strategic partnership with different key stakeholders that are working on global health and who wants also to invest more on climate and health. So this is an example of what we've got in terms of outcome through one of the vehicles that the foundation is using to fund climate adaptation and health resilience, which is the call for proposal. So we received several and hundreds of projects. Amongst them, we've selected 22 top projects, and we have also our 2 regional accelerators that are really focusing in to provide support, oversight, capacity building. They are also mobilizing research institutions to really work with communities that are responding to climate and health through the approach of implementation science. So we are trying to really embed research into the implementation of climate adaptation programs. So what was also very interesting, and I wanted to emphasize that, is the variety of response on climate and health, and the richness of the solution that people come up in their project to adapt and to respond for a long-term resilience to climate and health. We have received projects that focus on really building a community health system that is resilient to climate change. We have also, for example, in the north of Burkina Faso, where communities are confronted to drought, at the same time of confronted to flooding that are coming quite rapidly. They come up with a very strong early warning system and anticipatory actions that communities themselves can do to be better prepared. We have in Ghana smart agriculture, very woman-driven smart agriculture program to guarantee food security and access to water in the region, as well as a good number of projects on climate sensitive disease and how to prepare and how to build the capacity and the resilience of the health system to deliver services that will also mitigate the impact of climate on infectious diseases and other diseases. And last but not least, really we have seen communities preparing for repetitive heat waves and the impact on maternal and child health. It was not obvious to understand that, but listening to people and looking at their proposal, you can easily relate how the heat waves are impacting very directly the life of pregnant women, the children as well as women in general. So you could see on your right the number of countries where program and projects have been selected, and you can see in the map also where we are trying to have program being selected. And it's only going to be bigger because in December we are going to launch a new call for proposal to continue to fund locally led adaptation program. This is, and I'll finish with that. This is also a report that we have we've launched during ANGA in September, which is really providing insight, reflection, strategic direction, and clear and concrete example on how we can accelerate the global response to climate and health, focusing on locally led adaptation and building the capacity and the capability of communities to prepare, protect, and adapt to climate change, as well as how do we better leverage finance to really support climate adaptation and health resilience in low and middle income countries. I will be very happy to share this report, which has been also have very high level and high profile personality and giant in the healthcare system that has also contributed at the sidelines of the work that we have done with communities. We could see you can see in the report that we are also trying also to emphasize the wisdom and the experience from communities while they're confronted to climate change and how they're developing innovative response that can help all of us to better respond to the impact of climate change on health. So I'll stop here and thank you very, very much.
Wow. Thank you, Priscilla and Dauda. I am a bit speechless. Thank you so much. That it really is a 360 approach, all the way from decarbonization and looking at that along the entire patient care pathway, but then all the way to these really very concrete initiatives and grants, innovation accelerators to effect change in the most vulnerable areas. So we've learned a lot. Thank you so much. Thanks to your presentation and your approach. I will hand over to our last speaker, Robin, before perhaps we can take a question or two. But thank you so much for that. And Robin Stott is joining us representing the UK Health Alliance on Climate Change. Dr. Stott's a founding member and now an ambassador. And Robin was also a consultant at a large London hospital and has been a climate activist for most of his life.
Well,
thank you so
very
much,
Marianne, for asking me to talk. I've been asked to talk about what health professionals can do in these rather dire circumstances. I'll offer a view on why we need to act, why it's difficult to get action, and why, regardless, we need to do what we need to do. And to do this, I'm going to briefly gallop through 5 particular things. First of all, what factors determine, for better or worse, our health? We've had a bit about this, but I've got a nice little slide to show it. Second, what changes to our planet are driving the climate and ecological emergency. Third, the present and likely future consequences to health, which you've already heard about quite a lot, so I won't be long on that. You know where the changes are most keenly felt, so I'll ignore that too. And then really talk about why it's so difficult to tackle these emergencies and what health professionals must do. First, I'll tell you a little joke which may help us understand the severity of the situation. There are two remote planets, Planet A and B, and they have health professionals on both. And Planet A says to Planet B, "Can you help me? We've got a bit of an emergency here. We have an epidemic of Homo sapiens." Planet B says, "We had that a while back. Don't worry, it doesn't last long." Now, I hope that what we can do will forestall the dire consequences of what will happen if we don't do anything. So first, what determines our health? Well, all of you know the antecedents to health, but this is a little diagram which reminds us that healthcare is only a very small component of what provides and determines whether we have good or bad health. Our genes may make up another 30%, but most importantly, as we all know, is the environment, the way we're born, live, learn, play, love, work, age, and die. And because this is where health, where the climate and ecological emergency will most vigorously impact, this is, of course, the territory we have to be concerned with most. So what does the climate and ecological emergency look like? Well, I use the Rockström, the institute in Sweden's planetary boundaries to help me understand this. And it's, I think, a very helpful way of so doing. And as you know, there are 9 planetary boundaries. For good human health and the health of other than humans, we have to live within these boundaries. You can see in the next few things how we're transgressing these boundaries. Climate change is worse. That's the CO2 levels, land change and deforestation. And I'm going to give a little example of how much worse this is in a minute. Biosphere diversity, genetic and functional worse. Biochemical imbalances, that's the phosphorus and nitrogen runoffs into water, much worse. The novel entities, there have been 140,000 novel entities since 1950. Most of them are getting into our environment and causing big hassles. And then all the other factors are worse apart from the ozone layer. So let's take a quick look at the empirical evidence for what these planetary transgressions are doing. We know that the carbon dioxide levels have risen from 250 in 1850 to 420 now, and are still going up. We know that 25% of agricultural land is degraded. This could be 95% by 2050. Think of the consequences of that. We know that extreme drought affects 18% of land now, and 47% of land, in 1950, and 47% of land now, getting worse and worse by the year. We know that we're having a 6th extinction event with species lost 1,000 times the pre-industrial base rate. We know that there's widespread eutrophication, that's the presence of nitrogen and phosphorus in water, with algal blooms and ensuing hypoxia of sea and water, which decimates fish and other residents of the water. We know that plastics are now present in all oceans, and insect populations are plummeting. So the health impacts, it's not surprising that with these ecological boundaries being transgressed, and with the various problems that are ensuing as a consequence, that there are significant and dreadful health impacts. We've already talked about some of these, but just again to recap, 7 million premature deaths, worth perhaps $2.2 trillion per year, that's 3% of global GDP. 127 more people experiencing food insecurity. Heat-related deaths going up dramatically. Lots of work days lost because of hot days, and this constitutes a large percentage of GDP in many low-income countries. We talked about the increased transmission of various diseases. We talked about the difficulties of healthcare infrastructure, which are significant and we've already heard a lot about. We haven't talked much about eco-anxiety, which is a dominant feature of many societies now, and which is causing major problems in the health, particularly of young people. Given these health impacts, and given that we know what we do know, why has it been so very difficult to get any purchase? Health professionals have been alerting the population to these problems for 35 years in some circumstances. And yet, as you can see, things are getting worse, not better. We have to understand quite why that should be. And of course, some of it is the problems with money and finances. And perhaps I should first look at the fossil fuel companies. Many of them say they're going towards a non-fossil fuel future, but last year there was $1 trillion invested in exploration, and only 4% of that went into renewables. This is a 10% increase from 2021, and the fossil fuel countries are making £4 trillion in profit. The banks are lending the fossil fuel companies £500 billion for exploration. Our governments subsidize the fossil fuel companies by at least $305 billion a year. That's a gross underestimate, probably, but it's a very minimal. That's the minimal amount that we do it. The fossil fuel companies spent $140 million in the 2020 federal elections, persuading many of the representatives in the American government to do everything they could to bar action on climate change. This has gone up from 23 million in 2006. In contradistinction, governments in Copenhagen in 2009 promised $100 billion a year for climate action, and it's only just, that figure has only just been reached now. So we've had 14 or 15 years of really very little investment from the international community into climate mitigation. This is all very depressing and makes one feel very despondent. And the final problem, of course, is us. We humans seem to be addicted to consumerism and growth, and that is inimical to us tackling the climate change. We have somehow to understand the psychological transformation that we're going to have to get over this. So what can we do? Well, we must decarbonize health. We talked about that. We've got to stress the relevance of win-win policies. We've talked about that too. Active transport, clean air, plant-based diets, regenerative agriculture, and those are all relatively straightforward things. What else should we and must we do? Well, we have to mobilize health professions through collective action. The UK Health Alliance on Climate Change is one way of so doing. It's an organization of 45 separate organizations responding 1.5 or 1.2 or 3 million health professionals in the UK. It's a model which we think should be adapted throughout the world. We have to campaign for a circular economy. Health professionals have got to be engaged in wider issues. We need to understand that growth and consumerism is inimical to us being able to tackle the climate emergency. We health professionals have to be educated in understanding the importance of getting to circular economies and not relying exclusively on growth, which is resource consumptive. We have to vote for only those who prioritize the climate emergency. Every vote we have counts in whatever circumstances we are, whether it's in our workplace, in our local community, or nationally or internationally. We have to declare the ecological emergency as a public health emergency. WHO is already doing this, so are many others. But we have to insist that's the case and use our voices to make that prominent the whole time. we have to do even more. We have to recognize that what's happening, the collusion between fossil fuel companies, banks, and governments is in fact ecocidal and genocidal. We need to raise the stakes. Health professionals need to understand that we're facing a catastrophic situation which is not being helped by this collusion between fossil fuel companies, banks, and governments. And some of us have got to consider taking non-violent direct action. Health professionals are much regarded and being involved in these initiatives to try and stop, for instance, the opening of fossil fuel exploration sites is a really important action for health professionals. So we've got a lot to do. We hope we can use our status and our influence to do it. And I wish you all the best of luck in stopping what is, at the moment, looks like a catastrophic emergency. So thank you very much.
Robin, thank you very much for this rather sobering presentation, but at the same time, really, really important to be very realistic. And also for giving us that really important and useful list of do's. Certainly for many of our audience who perhaps are working in the healthcare sector, but on a research level, primary healthcare, it's very important to tap into those points. So thanks a lot. In terms of timing, we're running a little bit over, but before saying goodbye to our speakers, I did really want to ask you one question that perhaps would help anyone working in the field of neglected tropical diseases. So we've heard a lot of really wonderful initiatives, sources of funding, frameworks, and your very practical suggestions, Robin, to move the agenda, to help the healthcare sector reduce climate impact on health. It strikes me that the neglected tropical disease community has also had great experience. And in fact, Diana mentioned a movement. There's also a movement within NTDs, and that's really about advocacy for the world's most vulnerable communities, the very same communities that will be most at risk of climate change and its impact. So just based from your experience and with these major milestones coming up, COP and just advocacy running across the year in general, how can those working in neglected tropical diseases join and support and amplify this advocacy to mitigate the impacts of climate? What would be some of your thoughts that really are tailored to this tropical disease community? Perhaps I could start with you, Robin, and I see Priscilla's video is spinning, at least on my side. Sometimes refreshing the page just helps.
Well, thank you, Marianne. I don't distinguish between the community involved in neglected tropical diseases and other health professional workers. We're all together. We have to raise our game. We're in a situation of extreme and dire necessity to do something more positive and active. We need to join the various coalitions which are already forming and which, of course, you are part. We need to find ways of exerting our influence on government in a much more effective way than we do now. And we have to realize that actually we're up against an extremely tough opposition. We tackled them in the tobacco scene back in the 1980s. They're the same group, and we have to use the same tactics to try and understand that just information is actually radically inadequate. We've been telling people for 30 years what's happening. We haven't made an impact. We have to find alternative ways, and I think that each community needs to find a way of amplifying its efforts.
Fantastic, thank you. And Priscilla, for some concluding words of advice for those in tropical diseases to raise their voices in terms of advocacy to amplify that of climate.
Okay, can you hear me?
Yeah, we can see you and hear you very well.
Okay, great. Well, this is, I think, was more for Dauda, but I like concerning the vulnerable communities. I think it's it's a lot about, and I hope you'd second me on this, channeling the funding as well today to adaptation to local communities. Only 4% of the international funding on climate adaptation is currently going to these communities and helping them to adapt to the circumstances. And we think that this needs to be increased a lot, and the impact's already there. It's not bound to happen. They're already living with them. And so it's about acting now and making sure that we give them the means to be able to adapt to these events.
Thank you. Well, that's brilliant. And we will definitely keep an eye on that December launch for the funding call for proposals at Sanofi for local adaptation proposals. We've heard in this session many examples and the evidence for the impact of healthcare, negative impact of the sector on climate change, but also a huge amount of initiatives, frameworks, pathways to make an impact in a positive sense. So for that, we're really very grateful. Thank you so much to all our speakers. There's certainly never enough time to cover all the myriad of aspects of this very difficult and vast topic, but we've learned a lot today. And so we just wanted to really extend a very final thank you to all our speakers on this session. Thank you also to the audience for tuning in. And we will definitely be keeping in touch and following your many projects. Thank you so much for your time. And to round off this day, this ISNTD Climate and Health Day, I'm about to jump on to the final session of the day, which will be really broadening the lens even further of climate and health linkages by bringing in other perspectives, whether that be mental health, and that's something that you were alluding to, Robin, eco-anxiety. We're going to be looking at climate change and the Tanzanian youth and mental health impacts. We're also going to hear much more about flooding and the water management aspect, as well as repellents, and finally soil health. So we're talking about partnerships. We're broadening that up in this final session of what has been a very rich and informative day. But so I'm just putting up the link to that last session. But before I move on, I just want to say a very big thank you to everyone, and we'll be in touch. We'll hope to see you very soon again.
Thank you very much.
Thank you.